Match question. Streptococcus. It produces, the answer will be clotbuster. A2. So A2 is in, this is the only option with A2. So that has to be the correct answer. So 1 is the right answer of this question. So once you are confirmed that this is the right answer, immediately mark it. So 168 is 1. And now this will be the time you took to attempt this question. So if you're sure, mark it and then you're done with this question. Then go on to the other next question. So let's try to understand all these examples and the microorganisms. This question is from the chapter Microbes in Human Welfare from class 12th textbook. So Streptococcus is a bacteria and it produces clot busting enzyme which is called streptokinase. So why this is important? Because from the pathogenicity point of view, the enzyme helps this microorganism to invade inside and enter in the human tissues. Because what will happen in response to the injury, the first response is if there is bleeding, the body will produce a clot which will act as a barrier. Till the time skin grows, this clot is will cover that area and prevent any microorganism from entering in. So if a microorganism is capable of producing an enzyme which can digest clot, it is like breaking the barrier and entering in. So it gives advantage to the microorganism in case of infection. So for human beings, how is this important? There are many disorders in which clots are formed inside body or post trauma, post accident, then also there clots are formed inside body. So in that case, enzyme produced by recombinant DNA technology is very useful in saving lives. So that way this microorganism becomes very important from therapeutic point of view. Since we can isolate the gene which codes for streptokinase and then use it for therapeutic purposes. So next one, Trichoderma polysporum. Now this is one question which is asked so many times. So you please note it down. The name of this microorganism, it's a big name, Trichoderma polysporum. And here is the hint. This matches with cyclosporin. So what is cyclosporin A? A category of drug which is immunosuppressant. So immune suppression drug is given to those patients who have undergone organ transplantation, like kidney transplantation or liver transplant. So in this case, if the match is not 100%, what will happen? The recipient's immune system will attack the transplanted organ, and there might be rejection reaction that will be fatal to the recipient, and that will also be a loss because the or damaged organ will not be able to function properly. So in that case, the patient has to take immunosuppressant for a very long time. By hearted, it's frequently asked question, very important. The next one, Monascus purpureus. This is statin. What are statins? They are cholesterol lowering agents or cholesterol lowering drugs. So this particular molecule, it inhibits an important enzyme which is HMG-CoA of mevalonate pathway. Now don't think that mevalonate pathway is like glycolysis. Glycolysis is a straight simple pathway. It has it doesn't diversify. So it begins with glucose and ends in pyruvate. But mevalonate pathway has many different molecules. It branches out and produces important molecules. So one should not just consume it to control cholesterol. You cannot use it that way casually. And if it is used indiscriminately, it can have fatal effects on. So you know this now, but don't recommend it to anyone. because it has to be recommended, prescribed by a professional doctor. For your information and with respect to this chapter and this exam, remember that the name of the organism, the statins, and what is the use. It is cholesterol lowering agent. And the last one is Aspergillus niger, and it produces citric acid. So that's all about this question. Thank you so much for watching my video.